Yesterday, the Department of Public Health reported 1,400 new cases on about 58,000 tests. We're right around 20 million tests at this point that have been reported. 714 individuals are in the hospital and 165 are in the ICU. With respect to vaccines, over 4.6 million total doses have been administered in Massachusetts, including 2.8 million first doses and 192,920 doses of J&J. We're on track to fully vaccinate 2 million residents here in the Commonwealth this week, which would be about halfway to our goal for vaccinating eligible individuals in Massachusetts. We're hopeful that we will far exceed that goal and get as many people vaccinated as possible. We continue to be a national leader with respect to getting our residents vaccinated. We have been and continue to be the top state among the 24 states with over 5 million people in administering both first and total doses per capita, and we remain a top 5 state among all states in administering first doses. 85% of our residents aged 75 and older have received at least one dose of the vaccine, and over 83% of residents 65 and older have received at least one dose of the vaccine, which is ahead of the national average of about 75%. And 80% of the people over the age of 60, that would include me, have received at least one dose. Before I get into more detail on the allocations for this week, I do want to talk a bit about the pause on J&J. Yesterday morning, the CDC and the FDA recommended an immediate pause for the administration of J&J doses nationwide, and Massachusetts, like other states, complied with this request out of an abundance of caution and are awaiting more information from federal medical experts. According to the FDA and the CDC, out of nearly 7 million doses of J&J administered to date in the U.S., 6 cases of an extremely rare but serious medical condition have been reported. This equates to less than 1 per 1 million. None of these cases occurred in Massachusetts. Federal medical experts are leading the investigation into these cases, and today the CDC has convened a meeting of experts to further investigate these cases, and the FDA will review that analysis, and we obviously eagerly await further guidance with respect to next steps. According to federal officials, more information is expected to be available within days to help states manage vaccine distribution, and in the meantime, J&J shots will remain paused here in the Commonwealth. The health and safety of our residents remains a paramount and fundamental concern for us, and the Commonwealth will closely monitor this issue and follow federal guidance as we continue to move forward with our vaccination program. The J&J supply in Massachusetts is currently a small portion of our supply, and in the immediate future we're expecting minimal disruptions to schedule new appointments. For example, this week the Commonwealth received 11,600 doses of J&J as part of our state allocation. We're receiving 340,000 doses of Moderna and Pfizer as part of that same state allocation. J&J therefore accounted for about 3% of this week's doses. If you currently have an appointment scheduled to receive a J&J vaccine and have questions about your appointment, you should reach out to your provider or the vaccination clinic where you have that appointment scheduled. According to the CDC and the FDA, severe symptoms, not mild flu-like symptoms, have been reported within 2 weeks of the J&J vaccines for these rare individual cases, and they involve things like severe abdominal pain. If you've received the vaccine recently and experience unusual symptoms, severe pain in the abdomen, severe headaches, severe leg pains, you should definitely reach out to your clinician. Now, with respect to this week's allocation, it includes 353,660 first and second doses. It's 208,260 first and second doses of Pfizer, 133,800 first and second doses of Moderna, and as I said before, 11,600 doses of J&J, which will be paused. For next week, the federal government's notified us that we'll receive a modest increase in Pfizer and Moderna doses next week, something around 8%. In addition, this week the federal government's directly allocated 272,360 doses to community health centers, the federal retail pharmacy program, and their community vaccination sites. The community vaccination sites, which are part of the FEMA program, which supports the Hines operation here, and some mobile vaccination clinics, will continue to receive 42,000 doses per week directly from the federal government. Through the direct federal allocations, the federal retail pharmacy program will receive about 130,000 doses, and another 8,000 doses are being sent to pharmacies from this state allocation. Community health centers are receiving 79,250 doses between the state allocation and the direct allocation that they're getting from the federal government. Now, with respect to today's announcement, as everybody knows, April 19th is right around the corner, and at that point in time, all individuals over the age of 16 will be eligible for a vaccine here in Massachusetts. This is a significant milestone in our mission to vaccinate eligible residents and bring this pandemic to a close. As a critical part of our vaccine administration program, we've launched targeted outreach efforts in the communities that have been most disproportionately impacted by COVID to raise awareness and increase access to vaccination opportunities. We've been working closely with trusted local partners and community-based organizations to reach residents in these communities. And today, to boost this effort, we're pleased to announce a Red Sox Week at the Hines. It's a week-long initiative here at the Hines Veterans Convention Center designed to increase vaccine access for populations that are disproportionately affected by COVID-19. The initiative will be running in partnership with the Red Sox, the Base, El Mundo, and CIC Health. And it, of course, would not be possible without the support and the increased doses the site gets from FEMA each and every day. Between April 19th and the 25th, up to 20,000 first dose appointments will be reserved for residents from disproportionately impacted communities. Appointments are being scheduled through grassroots outreach efforts by community partners that are standing here with us today. They include the Red Sox Foundation, El Mundo, the Base, Archipelago Strategies Group, Healthcare for All, and the Boston Public Health Commission. For the week of April 19th, any unfilled appointments will be booked through the Commonwealth's pre-registration system. All of these organizations have strong presence in the state's 20 disproportionately impacted communities and are working hard to get more people and households out to get their shots. And have even tried to have a little fun with this one with the Red Sox while doing so. Red Sox Week at the Hines will include bilingual Spanish-speaking staff and volunteers, Spanish signage to help direct guests through the on-site registration and vaccination process, and Red Sox-themed attractions, including a selfie station, Red Sox trophies, socially distanced visits with Wally the Green Monster, and a raffle to win tickets to a Red Sox game. We understand the vaccination process can sometimes be stressful for some individuals, especially those who come from communities that have been hit hard by the virus. Our goal is to encourage more people to come to Boston with family and neighbors to get vaccinated together and to also create an experience in Spanish from beginning to end. Residents who have their second doses scheduled for the Hines will have their appointments honored, and you may have the extra bonus of getting a glimpse of Wally the Green Monster while you're here. The extra bonus. You got that, Jonathan? Okay. Beginning Monday, all individuals in the Commonwealth 16 and older will become eligible for the vaccine. That's an additional 1.7 million people. While our supply from the federal government has seen a modest increase, as I said before, our capacity to administer doses remains much greater than the number of doses we get each week. For people who become newly eligible on Monday, you should expect it may take several weeks to book an appointment, and information for all vaccine sites are available at mass.gov/COVID vaccine. If you're seeking an appointment at a mass vaccination site, pre-register for an appointment at mass.gov/COVID vaccine. Our tech team continues to work hard to improve our website and user experience and is prepared for the influx of traffic that will probably occur before and on the 19th. This week, 4 new regional collaboratives will be added to our pre-registration system: Northborough, West Springfield, Palmer, and Northampton. That makes a total of 6 regional collaboratives now on the VaxFinder to increase visibility for users. If you're looking for an appointment at one of these regional sites, please pre-register. And even if you pre-register, you can obviously continue to look for an appointment at other providers like pharmacies, community health centers, and your healthcare provider. In fact, I would say at this point we've had, what, about 300,000 people who pre-registered and then unregistered because they got an appointment somewhere else? Yeah. Is that about right? Okay. We're working to get doses to eligible people as fast as we can, but how fast we move will continue to depend on how fast we get doses from our friends in Washington. The vaccine saves lives, and it's our way out of this pandemic. And I can't emphasize enough how much real-life data we now have that demonstrates that folks who get vaccinated in large numbers present much fewer cases and much fewer hospitalizations than they were just a few months ago. The best example of all of this is the senior population, whose number of case counts and whose hospitalizations have literally dropped like a rock since they started getting vaccinated back at the end of December. Millions of people across the country have been vaccinated, and I got my first shot in this building about 10 days ago and will be back for my second one around the end of the month. And it's critically important, I believe, for me and for my family that I get vaccinated. And I think it's critically important for everybody when they have that opportunity to sign up and get vaccinated. And if you have questions about the vaccine, you can always talk to your healthcare provider or to other trusted experts in your community. The vaccine's a big part about getting back to what we might call normal. And it's critical for all of us to take advantage of this opportunity when we have it. Doesn't mean we should let down our guard. Everybody still needs to pay attention to the rules associated with masks and distance and hygiene. And the rules and guidance that we have in place for employers will continue to be an important part of how we deal with variants and the vaccine that and the COVID consequences that remain here in the Commonwealth as we work our way through this vaccine protocol. But as I said before, when you're eligible, please sign up and get vaccinated. It's the best thing you can do for you, your friends, your family, your coworkers, and your neighbors.